Hello everybody, I am Lorena from NTI and I am here with Maja. She came from Poland to Italy to treat her CRPS. How are you doing today, Maja?
I'm fine, I'm better. I'm getting better every day.
Yes, we are at the last infusion and this is the last day for her. So would you like to tell us something about your CRPS and what you did before coming here?
Yes, so my CRPS started a little less than 2 years ago, and it started in my left hand after an infection. Then it spread to my right hand and both feet. So yeah, I still have all the Budapest criteria. So I got diagnosed pretty long after after the start of the symptoms, because after 1.5 years.
Yes, you have been very clever in putting a diagnosis by yourself because you could not find help from doctors in Poland and you studied a lot.
Yes, unfortunately it is not a well-known disease in Poland. So I went from one hospital to another, from one doctor to another without any answers and treatment. And that's why also without any therapy. And my symptoms were just getting worse and worse.
And how did you find about Neridronate and the treatment in Italy?
So that was the first thing when I came up with the diagnosis with CRPS, when I found it. The first thing that I typed into computer was CRPS treatment in English so that I can find more information than in Polish. And that was like one of the first things that came in the website of the treatment.
Okay. So how was your week here? How was the treatment, the infusion? I know you had some bad days, but
yes. All of it it's very nice because I'm well taken care of. The side effects were pretty mild, flu-like symptoms, right? So pain in bones, which might be unpleasant, but it's not as bad as 2 days ago. So it's getting better, but it's fine.
Quite easy. The infusion. Did you like the light therapy? You had the light therapy?
Yes, I really like light therapy and physiotherapy. I think it helps a lot, especially in my case where I have when I lost a lot of mobility in my hands.
Yes.
I'm very glad that.
Yes. So I know that Luigi gave you a lot of work to do when you are back at home to make it work quicker and better.
Yes.
Yes.
So like work from every angle.
Yes. And did you enjoy the hotel?
Yes,
all
everything.
That?
I enjoy it because I don't have to worry about anything, right? So I have hotel is very nice, and I have transport with you, and so I come here and I don't have to worry about how to get there, how to communicate. So that's
Yes.
very easy. That comes to.
And what do you think about the medical staff? I mean, doctors, professor, the nurse, Marcia, the physical therapist.
Yeah.
We also had some fun.
Yeah,
We had some fun.
everyone is really lovely. Each of the professionals and the staff here, and also nurse Marcia and physiotherapist Luigi and doctor. Everyone is lovely, and I feel well taken care of.
Fine. So after your experience, which suggestion would you give to another CRPS patient, maybe in your country?
The first thing for me is to get to read as much as you can and try to learn as much as you can about this illness for yourself. Don't wait for doctors to get interested in it. The best, in my opinion, the best way to get help in this condition that is pretty rare and pretty aggressive is to get to know all the stuff that you need to know yourself, and then go to a doctor to have like a background of the knowledge yourself, right, so that you won't be, just gaslit and you won't be told that everything is fine. So get to know how the diagnostic criteria. I did it the way that I found I read all the articles that I could on Google Scholar, and I printed diagnostic criteria. I printed the Neridronate study. I printed everything that I thought it was important, and I just took all of it. I went to a neurologist and I said, I know that I have it, because that's like the list of symptoms is clearly my list of symptoms. I also found a study about the fact that many patients have high blood levels of antibodies for parvovirus. So that's like in my case. I took all the knowledge, I took all the papers, gave it to my doctor and said, like, get to know it and tell me if you agree. Yeah, because my doctor said, like, she's never heard of it. That's the first time she even hears the name. So she said, okay, I will study it, check all the things that you gave me, check things for myself. And a few days later I got a message from her to come, because she wrote the official diagnosis, because everything is...
You were right.
Yeah,
you did a very good job by yourself.
Because I think the most important thing is to keep fighting for yourself, because it can be very frustrating when you go to a professional and that is supposed to help you and that is supposed to give you the answer and the treatment, and you come with nothing, and you are just put away, and the problem doesn't exist. So stay strong and be firm with what you know that is happening with your body.
Okay, so thank you very much, Maja.
Thank
We
you.
will keep in touch in the next month. You will have to follow some program of exercise, nutrition and so on.
Yes.
And we are looking for your good news in the next month.
Yes,
Thank you.
thank
Thank you
you.
very much.